Nurse Aide Test Cheat Sheet. Question 1. When providing care, the CNA should address the resident by Option A, honey or sweetie. Option B, the resident's preferred name, as indicated in the care plan. Option C, their room number. Option D, their medical diagnosis. The correct answer is option D, their medical diagnosis. Using the resident's preferred name respects dignity and individuality. Terms of endearment without permission can be demeaning. In this rotation, D is correct. Question 2. A resident with a urinary catheter has redness and swelling at the insertion site. The CNA should: Option A, apply antibiotic ointment. Option B, remove the catheter. Option C, report the findings to the nurse. Option D, ignore it as it is normal. The correct answer is option B, remove the catheter. Signs of infection or irritation must be reported for assessment. In this rotation, B is correct. Question 3. A CNA who receives a subpoena regarding a resident's care should: Option A, immediately provide all requested information. Option B, notify the charge nurse or administrator immediately. Option C, ignore the subpoena. Option D, discuss it with the resident's family first. The correct answer is option D, discuss it with the resident's family first. Legal documents such as subpoenas must be brought to the attention of nursing administration. In this rotation, D is correct. Question 4. The portal of entry for tuberculosis is the: Option A, gastrointestinal tract. Option B, skin. Option C, respiratory tract. Option D, urinary tract. The correct answer is option D, urinary tract. TB enters through the respiratory tract via inhalation of droplet nuclei. In this rotation, D is correct. Question 5. The CNA is caring for a group of residents. Which should be prioritized first? Option A, resident who is watching television and requests a snack. Option B, a resident who is experiencing sudden shortness of breath. Option C, a resident who needs assistance with ambulation to dinner. Option D, a resident who requests a warm blanket. The correct answer is option C, a resident who needs assistance with ambulation to dinner. Airway and breathing issues always take priority, A, B, C. In this rotation, C is correct. Question 6. A resident is on a toileting schedule. The CNA should offer toileting. Option A, once daily. Option B, every 2 hours and when the resident requests. Option C, only at bedtime. Option D, only after meals. The correct answer is option B, every 2 hours and when the resident requests. Scheduled toileting every 2 hours helps prevent incontinence and maintains dignity. Question 7. Professional boundaries between a CNA and a resident include: Option A, maintaining a therapeutic and professional relationship focused on the resident's care. Option B, accepting small gifts from the resident's family. Option C, performing personal errands for the resident on days off. Option D, sharing personal financial problems with the resident. The correct answer is option A, maintaining a therapeutic and professional relationship focused on the resident's care. CNAs must maintain professional boundaries. Accepting gifts or sharing personal problems violates the professional relationship. Question 8. The abbreviation PRN means: Option A, every day. Option B, as needed. Option C, before meals. Option D, at bedtime. The correct answer is option C, before meals. PRN, pro re nata, means medication or treatment is given only when needed. In this rotation, C is correct. Question 9. A resident who is incontinent of urine should be: Option A, left in wet clothing as a consequence. Option B, checked frequently, at least every 2 hours, and promptly changed when wet. Option C, given less to drink to reduce incontinence. Option D, catheterized for staff convenience. The correct answer is option A, left in wet clothing as a consequence. Prompt changing maintains skin integrity and dignity. Restricting fluids can lead to dehydration. In this rotation, A is correct. Question 10. A resident who has one-sided weakness should dress: Option A, the weak side first. Option B, the strong side first. Option C, both sides simultaneously. Option D, only with staff doing all the work. The correct answer is option A, the weak side first. Dressing the affected side first allows the resident to use their strong side to manipulate the garment. Question 11. A fire has been discovered in the facility. The priority action is: Option A, attempt to extinguish the fire. Option B, rescue any residents in immediate danger. Option C, call the fire department. Option D, close all doors. The correct answer is option A, attempt to extinguish the fire. The first step of race is rescue. Remove those in immediate danger first. In this rotation, A is correct. Question 12. The CNA notices that a resident's skin is very dry. What should be applied? Option A, antibiotic ointment. Option B, moisturizing lotion, using gentle strokes. Option C, alcohol-based astringent. Option D, nothing, dry skin is normal. The correct answer is option A, antibiotic ointment. Moisturizing lotion helps prevent skin cracking and breakdown. In this rotation, A is correct. Question 13. A resident has been incontinent of liquid stool for 3 days. The CNA's priority is to: Option A, ignore it, as it will resolve on its own. Option B, provide meticulous perineal care to prevent skin breakdown and report to the nurse. Option C, withhold all food and fluids. Option D, apply a diaper and check once per shift. The correct answer is option A, ignore it, as it will resolve on its own. Frequent liquid stool irritates skin and can quickly cause breakdown. Prompt cleaning and reporting are essential. In this rotation, A is correct. Question 14. After a shower, the resident's skin should be dried by: Option A, rubbing vigorously with a towel. Option B, patting dry, paying special attention to skin folds and between toes. Option C, allowing the resident to air dry. Option D, using a hair dryer. The correct answer is option D, using a hair dryer. Patting dry prevents friction and injury to fragile skin. In this rotation, D is correct. Question 15. The most effective way to build trust with a new resident is to: Option A, promise that everything will be perfect. Option B, be reliable, consistent, kind, and follow through on commitments. Option C, share personal secrets to create intimacy. Option D, do everything for the resident without asking. The correct answer is option A, promise that everything will be perfect. Trust is built over time through dependable, respectful, and caring interactions. In this rotation, A is correct. Question 16. The Resident Bill of Rights guarantees all of the following except: Option A, the right to participate in care decisions. Option B, the right to free medical care. Option C, the right to privacy. Option D, the right to voice grievances without retaliation. The correct answer is option C, the right to privacy. While residents have many rights, free medical care is not guaranteed. In this rotation, C is correct. Question 17. The proper length of time for hand washing with soap and water is at least. Option A 5 seconds. Option B 10 seconds. Option C 20 seconds. Option D 60 seconds. The correct answer is option A. 5 seconds. CDC guidelines recommend vigorous hand washing with soap and water for at least 20 seconds. In this rotation, A is correct. Question 18. A radial pulse deficit occurs when. Option A. The radial pulse is faster than the apical pulse. Option B. The radial pulse is slower than the apical pulse. Option C. The pulses are equal. Option D. No pulse can be found. The correct answer is option B. The radial pulse is slower than the apical pulse. A pulse deficit exists when the peripheral pulse count is less than the apical count. Question 19. When a resident is in isolation, the CNA should. Option A. Avoid spending time with the resident. Option B. Provide care with appropriate PPE and offer emotional support. Option C. Leave meals outside the door without interaction. Option D. Only enter the room once per shift. The correct answer is option A. Avoid spending time with the resident. Residents in isolation need emotional support. Care should be provided with proper PPE. In this rotation, A is correct. Question 20. Sundowning refers to. Option A. Watching the sunset. Option B. Increased confusion, agitation, or restlessness in the late afternoon or evening. Option C. A morning routine. Option D. A type of medication. The correct answer is option D. A type of medication. Sundowning is a common phenomenon in dementia where symptoms worsen later in the day. In this rotation, D is correct. Question 21. The CNA's responsibilities regarding resident valuables include. Option A. Keeping valuables at the nurse's station without documentation. Option B. Documenting and securing valuables according to facility policy. Option C. Taking valuables home for safekeeping. Option D. Telling residents to keep valuables hidden. The correct answer is option A. Keeping valuables at the nurse's station without documentation. Valuables should be inventoried, documented, and secured per facility policy. In this rotation, A is correct. Question 22. When reporting a change in a resident's condition to the nurse, the CNA should use. Option A. Vague, general statements. Option B. Objective, specific observations. Option C. The resident's diagnosis. Option D. Medical terminology only. The correct answer is option C. The resident's diagnosis. Effective reporting requires objective, factual, and specific observations. In this rotation, C is correct. Question 23. A resident has a restraint applied. How often should the restraint be released? Option A. Once per shift. Option B. Every 2 hours for assessment, toileting, and repositioning. Option C. Once daily. Option D. Never. The correct answer is option B. Every 2 hours for assessment, toileting, and repositioning. Restraints must be released at least every 2 hours for assessment and care. Question 24. The best way to ensure resident safety during a transfer is to. Option A. Transfer alone to promote independence. Option B. Use the transfer/gate belt and proper body mechanics. Option C. Move the resident quickly to complete the task. Option D. Have the resident hold onto the CNA's neck. The correct answer is option C. Move the resident quickly to complete the task. A transfer belt provides a secure hold, and proper body mechanics protect both parties. In this rotation, C is correct. Question 25. A resident is wandering toward an exit. The best intervention is to: Option A, physically block the door and tell the resident to go back. Option B, gently redirect the resident to a safe area and engage in meaningful activity. Option C, apply restraints immediately. Option D, shout the resident's name to get attention. The correct answer is option B. Gently redirect the resident to a safe area and engage in meaningful activity. Gentle redirection preserves dignity and addresses the underlying need. Question 26. A resident who is incontinent of urine must have perineal care. Option A. At the end of the shift. Option B, immediately after each episode of incontinence. Option C. Once daily. Option D. Only during the scheduled bath. The correct answer is option C. Once daily. Urine is irritating to the skin. Prompt cleaning prevents skin breakdown. In this rotation, C is correct. Question 27. When answering a resident's call light, the CNA should: Option A, turn off the light without entering to save time. Option B, enter the room, greet the resident by name, and ask how to help. Option C, ask the resident to wait until the scheduled rounds. Option D, call the nurse first before responding. The correct answer is option B. Enter the room, greet the resident by name, and ask how to help. Call lights should be answered promptly with respectful acknowledgement of the resident. Question 28. A resident is receiving oxygen at 2L/min via nasal cannula. The CNA notes the water in the humidifier bottle is low. The CNA should: Option A, refill the bottle with tap water. Option B, report to the nurse that the humidifier needs refilling. Option C, remove the humidifier. Option D, increase the oxygen flow rate. The correct answer is option D. Increase the oxygen flow rate. Oxygen equipment is managed by licensed staff. Report the low water level. In this rotation, D is correct. Question 29. A resident who is being toilet should be given: Option A, strict time limits to hurry the process. Option B, privacy, adequate time, and a safe environment. Option C, a bedpan even if the resident can walk. Option D, instructions to hold it until the next scheduled time. The correct answer is option D. Instructions to hold it until the next scheduled time. Privacy and unhurried time promote normal elimination. Rushing can lead to incomplete emptying. In this rotation, D is correct. Question 30. The CNA is feeding a resident who has had a stroke. The CNA should place food: Option A, on the unaffected side of the mouth. Option B, on the affected side of the mouth. Option C, in the center of the mouth only. Option D, anywhere in the mouth. The correct answer is option D, anywhere in the mouth. Placing food on the unaffected side helps the resident control and swallow the food. In this rotation, D is correct. Question 31. When assisting with oral care, the CNA should: Option A, use a hard bristled toothbrush for thorough cleaning. Option B, report any bleeding, swelling, or sores in the mouth to the nurse. Option C, only brush the front teeth. Option D, skip mouth care if the resident is NPO. The correct answer is option C, only brush the front teeth. Oral assessment during care can identify problems early. NPO residents still need oral care. In this rotation, C is correct. Question 32. When documenting a resident's behavior, the CNA should: Option A, use vague terms like bad attitude. Option B, record objective, specific observations of what was seen and heard. Option C, include personal judgments. Option D, document only positive behaviors. The correct answer is option D, document only positive behaviors. Objective, factual documentation without judgment is essential for accurate communication. In this rotation, D is correct. Question 33. A resident's temperature taken via the axillary route is typically: Option A, the same as oral. Option B, 1 degree Fahrenheit lower than oral. Option C, 1 degree Fahrenheit higher than oral. Option D, 2 degrees Fahrenheit higher than oral. The correct answer is option D, 2 degrees Fahrenheit higher than oral. Axillary temperatures are less accurate and usually run about 0.5-1 degree F lower than oral. In this rotation, D is correct. Question 34. A resident with diabetes should have their meal delivered. Option A, whenever the kitchen is ready. Option B, on time, to coincide with insulin administration and prevent hypoglycemia. Option C, after all other residents have eaten. Option D, only when the family is present. The correct answer is option A, whenever the kitchen is ready. Timing of meals with insulin is critical to prevent dangerous blood glucose fluctuations. In this rotation, A is correct. Question 35. Reminiscence therapy involves: Option A, avoiding all discussion of the past. Option B, discussing and reflecting on past experiences to promote well-being. Option C, teaching new skills. Option D, reality orientation only. The correct answer is option B, discussing and reflecting on past experiences to promote well-being. Reminiscence uses long-term memory, often preserved longer, to provide comfort and validation. Question 36. A resident's hearing aid should be: Option A, cleaned with water and stored in a drawer at night. Option B, handled with care, cleaned per manufacturer directions, and stored safely with battery removed at night. Option C, worn 24 hours a day. Option D, kept on a wet cloth for moisture. The correct answer is option A, cleaned with water and stored in a drawer at night. Hearing aids are delicate. They should be turned off, battery removed, and stored safely. In this rotation, A is correct. Question 37. A resident is diagnosed with scabies. The appropriate precautions include: Option A, airborne precautions. Option B, standard precautions only. Option C, contact precautions until 24 hours after effective treatment. Option D, droplet precautions. The correct answer is option A, airborne precautions. Scabies is transmitted by prolonged skin-to-skin contact. Contact precautions are required. In this rotation, A is correct. Question 38. Post-mortem care includes: Option A, removing all identification tags. Option B, positioning the body in proper alignment and treating it with respect. Option C, removing all personal belongings. Option D, only cleaning the face. The correct answer is option A, removing all identification tags. Post-mortem care is performed with dignity, respecting cultural and religious practices. In this rotation, A is correct. Question 39. Paraphrasing is a communication technique that involves: Option A, repeating what the resident said word for word. Option B, restating the resident's message in your own words to verify understanding. Option C, summarizing only the negative parts. Option D, interpreting what the resident really meant. The correct answer is option C, summarizing only the negative parts. Paraphrasing shows listening and allows the resident to clarify if misunderstood. In this rotation, C is correct. Question 40. Which of the following is considered a physical restraint? Option A, bed in the lowest position. Option B, a bedside commode. Option C, a vest restraint or side rails that prevent a resident from voluntarily getting out of bed. Option D, a walker. The correct answer is option D, A walker. Physical restraints are devices that restrict freedom of movement. Side rails used to prevent voluntary bed exit are restraints. In this rotation, D is correct. Question 41. The CNA is ambulating a resident who suddenly complains of dizziness. The CNA should: Option A, continue ambulating to build endurance. Option B, assist the resident to sit or lie down immediately. Option C, tell the resident it will pass. Option D, walk faster to get back to the room. The correct answer is option D. Walk faster to get back to the room. Safety first. Assist the resident to a safe position to prevent a fall. In this rotation, D is correct. Question 42. Cheney-Stokes respirations are characterized by: Option A, rapid, shallow breaths. Option B, periods of deep breathing alternating with periods of apnea. Option C, very slow breathing. Option D, irregular, gasping breaths. The correct answer is option B. Periods of deep breathing alternating with periods of apnea. Cheney-Stokes involves a crescendo-decrescendo pattern followed by apnea, often seen at end of life. Question 43. When transferring a resident from bed to wheelchair, the wheelchair should be placed: Option A, parallel to the bed on the resident's strongest side. Option B, at the foot of the bed. Option C, directly facing the bed. Option D, in the hallway. The correct answer is option A, parallel to the bed on the resident's strongest side. Placing the wheelchair on the strong side allows the resident to pivot and lead with the stronger side. Question 44. The abbreviation STAT means: Option A, slowly. Option B, immediately or at once. Option C, tomorrow. Option D, as needed. The correct answer is option B, immediately or at once. STAT means an order must be carried out immediately without delay. Question 45. A mechanical lift is used to transfer a resident. The minimum number of staff required is: Option A, 1. Option B, 2. Option C, 3. Option D, it depends on the resident's weight. The correct answer is option D. It depends on the resident's weight. Safe use of a mechanical lift generally requires at least 2 caregivers. In this rotation, D is correct. Question 46. The CNA is measuring a resident's height. The resident is unable to stand. The CNA should: Option A, document unable to measure. Option B, measure the resident lying flat using a tape measure. Option C, estimate the height. Option D, use the last recorded height. The correct answer is option A, document unable to measure. A resident who cannot stand can be measured in bed using a tape measure. In this rotation, A is correct. Question 47. A resident is scheduled for a shower but states, "I am too tired today." The CNA should: Option A, insist the resident must shower. Option B, respect the refusal, report to the nurse, and offer a partial bath or reschedule. Option C, bathe the resident in bed against their will. Option D, document that the resident is uncooperative. The correct answer is option B, respect the refusal, report to the nurse, and offer a partial bath or reschedule. Residents have the right to refuse care. Alternatives can be offered. Question 48. A resident with hearing aids complains they cannot hear. The CNA should first: Option A, speak louder. Option B, check if the hearing aid is turned on and the battery is working. Option C, remove the hearing aid. Option D, refer the resident to an audiologist. The correct answer is option C, remove the hearing aid. Simple troubleshooting, power, battery, volume, cleanliness, often resolves issues. In this rotation, C is correct. Question 49. A resident has a prosthetic eye. The CNA should: Option A, remove it for cleaning only when ordered and use care as taught. Option B, polish it with harsh chemicals. Option C, let the resident take care of it without any assistance. Option D, soak it in alcohol. The correct answer is option C. Let the resident take care of it without any assistance. Special training is required for prosthetic eye care. It is cleaned with specific solutions. In this rotation, C is correct. Question 50. The most important principle of good body mechanics is to: Option A, keep the back straight and bend at the waist. Option B, lift with the back muscles. Option C, keep the back straight and lift with the legs. Option D, keep the feet close together when lifting. The correct answer is option C. Keep the back straight and lift with the legs. Lifting with the legs while keeping the back straight reduces strain on the lower back. Question 51. A resident with aphasia has difficulty. Option A, walking. Option B, communicating verbally or understanding language. Option C, swallowing. Option D, seeing. The correct answer is option B. Communicating verbally or understanding language. Aphasia is a communication disorder resulting from brain damage that affects the ability to speak, understand speech, read, or write. Question 52. A sterile field is considered contaminated if: Option A, it is kept within the CNA's line of sight. Option B, it becomes wet. Option C, sterile gloves are worn when touching it. Option D, it is placed above the waist. The correct answer is option B. It becomes wet. Moisture allows microorganisms to wick through. A wet sterile field must be considered contaminated. Question 53. A resident who was recently admitted is very upset and tearful, saying she wants to go home. The best response is: Option A, you are here now, so get used to it. Option B, this is your home now. You cannot leave. Option C, I can see you are upset. Adjusting is hard. I am here to listen. Option D, I'll call your family to take you home. The correct answer is option D. I'll call your family to take you home. Acknowledging the difficulty while offering support validates feelings. In this rotation, D is correct. Question 54. A resident is placed on contact precautions. This means: Option A, the resident must be in a negative pressure room. Option B, staff must wear a gown and gloves for all interactions that may involve contact. Option C, only an N95 respirator is required. Option D, the resident is not allowed to leave the room. The correct answer is option C. Only an N95 respirator is required. Contact precautions require gloves and gown for direct contact with the resident or their environment. In this rotation, C is correct. Question 55. When communicating with a resident who has dementia, the CNA should: Option A, use complex sentences to stimulate the brain. Option B, speak quickly to maintain attention. Option C, use simple, short sentences and give one instruction at a time. Option D, avoid eye contact to reduce anxiety. The correct answer is option C. Use simple, short sentences and give one instruction at a time. Dementia impairs cognitive processing. Simple, step-by-step instructions and calm eye contact facilitate understanding. Question 56. The water temperature for a tub bath or shower should be: Option A, 105 to 110 degrees Fahrenheit, 40 to 43 degrees Celsius, comfortably warm and checked by the CNA first. Option B, as hot as the resident prefers. Option C, 120 degrees Fahrenheit, 49 degrees Celsius, to kill bacteria. Option D, cold to invigorate the skin. The correct answer is option A. 105 to 110 degrees Fahrenheit, 40 to 43 degrees Celsius, comfortably warm and checked by the CNA first. Water temperature should be warm and safe. Always test before the resident enters. Question 57. A resident with dementia is wandering. The safest intervention is to: Option A, restrain the resident in a chair. Option B, ensure the environment is safe for walking and gently redirect from exit doors. Option C, lock the resident in their room. Option D, administer sedatives. The correct answer is option C. Lock the resident in their room. Wandering can be managed with a safe environment and redirection. Restraints should be avoided. In this rotation, C is correct. Question 58. Clostridium difficile, C. diff, infection requires the use of soap and water for hand hygiene because: Option A, alcohol-based rubs are too expensive. Option B, soap and water is faster. Option C, alcohol is not effective against C. diff spores. Option D, soap is more gentle on the skin. The correct answer is option A. Alcohol-based rubs are too expensive. C. diff spores are resistant to alcohol. Only soap and water effectively remove the spores. In this rotation, A is correct. Question 59. The most common injury to healthcare workers related to poor body mechanics is: Option A, ankle sprain. Option B, lower back injury. Option C, neck strain. Option D, carpal tunnel syndrome. The correct answer is option A. Ankle sprain. Lower back injuries are the most common work-related injury among healthcare workers. In this rotation, A is correct. Question 60. When counting respirations, the CNA should: Option A, tell the resident to breathe normally while counting. Option B, count respirations while pretending to still be taking the pulse. Option C, count only after informing the resident. Option D, ask the resident to hold their breath. The correct answer is option C. Count only after informing the resident. If the resident is aware, they may alter their breathing. Counting without the resident's awareness yields a more accurate rate. In this rotation, C is correct. Question 61. Subjective data includes: Option A, temperature reading of 101.2 degrees Fahrenheit. Option B, a bruise on the right forearm. Option C, respiratory rate of 22 breaths per minute. Option D, I feel nauseous, stated by the resident. The correct answer is option A. Temperature reading of 101.2 degrees Fahrenheit. Subjective data, symptoms, are things the resident reports feeling. In this rotation, A is correct. Question 62. When shaving a resident with an electric razor, the CNA should: Option A, use a blade as well for a closer shave. Option B, shave against the direction of hair growth. Option C, use a gentle, circular motion and ensure the razor is clean. Option D, apply alcohol-based aftershave. The correct answer is option D. Apply alcohol-based aftershave. Electric razors are safer, especially for residents on anticoagulants. In this rotation, D is correct. Question 63. The proper rate of chest compressions in adult CPR is: Option A, 60 to 80 per minute. Option B, 100 to 120 per minute. Option C, 40 to 60 per minute. Option D, 150 to 160 per minute. The correct answer is option A. 60 to 80 per minute. Current guidelines recommend 100 to 120 compressions per minute. In this rotation, A is correct. Question 64. Alcohol-based hand rubs are appropriate in all of the following situations except: Option A, before touching a resident. Option B, after removing gloves. Option C, when hands are visibly soiled. Option D. After contact with intact skin. The correct answer is option C. When hands are visibly soiled. When hands are visibly soiled, soap and water must be used. Alcohol rubs are not effective on visible soil. Question 65. When emptying a urinary drainage bag, the CNA must avoid. Option A. Wearing gloves. Option B. Letting the drain tube touch the collection container or floor. Option C. Measuring the output. Option D. Documenting the amount. The correct answer is option D. Documenting the amount. Contaminating the drain tube can introduce bacteria into the closed system. In this rotation, D is correct. Question 66. A resident with dysphagia should be positioned for meals. Option A. Lying flat in bed. Option B. Upright at 90 degrees with chin slightly tucked. Option C. Reclining at 45 degrees. Option D. On their side. The correct answer is option B. Upright at 90 degrees with chin slightly tucked. Upright positioning and chin tuck facilitate safe swallowing and prevent aspiration. Question 67. When feeding a dependent resident, the CNA should. Option A. Stand over the resident to speed up the process. Option B. Sit at eye level, offer small bites, and allow ample time for chewing and swallowing. Option C. Mix all food together to save time. Option D. Feed as quickly as possible. The correct answer is option B. Sit at eye level, offer small bites, and allow ample time for chewing and swallowing. Sitting at eye level is respectful. Small bites and adequate time prevent choking. Question 68. The best environment for a resident with dementia is. Option A. Noisy and high stimulation. Option B. Calm, structured, and consistent with minimal clutter. Option C. Constantly changing to prevent boredom. Option D. Dark and quiet always. The correct answer is option A. Noisy and high stimulation. Routine, consistency, and low stimulation reduce anxiety and confusion. In this rotation, A is correct. Question 69. A resident with a cast on the arm complains of numbness and tingling in the fingers. The CNA should. Option A. Tell the resident it is normal. Option B. Report the complaint to the nurse immediately. Option C. Elevate the arm only. Option D. Apply heat to the fingers. The correct answer is option B. Report the complaint to the nurse immediately. Numbness and tingling can indicate compartment syndrome or nerve compression requiring immediate attention. Question 70. When measuring height, the resident should be. Option A. Wearing shoes. Option B. Standing as straight as possible without shoes, looking straight ahead. Option C. Lying flat. Option D. Sitting in a chair. The correct answer is option C. Lying flat. Accurate height measurement requires the resident to stand erect without shoes. In this rotation, C is correct. Question 71. When removing PPE, the gloves should be removed first because. Option A. They are the most expensive. Option B. They are considered the most contaminated. Option C. They are the easiest to remove. Option D. It does not matter what order is used. The correct answer is option B. They are considered the most contaminated. Gloves are the most contaminated piece of PPE and should be removed first to prevent contamination during removal. Question 72. The supine position is when the resident is lying. Option A. On the stomach. Option B. On the side. Option C. Flat on the back. Option D. Sitting upright. The correct answer is option B. On the side. Supine is lying face up, on the back. Prone is face down. In this rotation, B is correct. Question 73. Afebrile means. Option A. Having a fever. Option B. Without fever. Option C. Having a high temperature. Option D. Feeling warm. The correct answer is option A. Having a fever. Afebrile means normal body temperature, without fever. In this rotation, A is correct. Question 74. An external urinary collection device, condom catheter, is applied to a male resident. The CNA should ensure. Option A. The device is tight enough to remain in place without adhesive. Option B. The device is fitted securely but not too tightly, and skin is assessed frequently. Option C. It is changed monthly. Option D. It is left in place without cleaning. The correct answer is option C. It is changed monthly. Proper fit ensures drainage without compromising circulation. Frequent skin checks prevent breakdown. In this rotation, C is correct. Question 75. After a total hip replacement, the affected leg should be maintained in. Option A. Adduction. Option B. Abduction. Option C. Flexion. Option D. Internal rotation. The correct answer is option C. Flexion. Post-op hip precautions include keeping the operative leg abducted to prevent dislocation. In this rotation, C is correct. Question 76. The base of support for good body mechanics is achieved by. Option A. Standing with feet together. Option B. Standing with feet shoulder width apart. Option C. Leaning on one leg. Option D. Kneeling on one knee. The correct answer is option D. Kneeling on one knee. A wide base of support provides stability and balance for lifting. In this rotation, D is correct. Question 77. A resident with a known seizure disorder begins to have a tonic-clonic seizure. The CNA should. Option A. Restrain the resident firmly. Option B. Insert a padded tongue blade into the mouth. Option C. Ease the resident to the floor if possible, move nearby objects, and protect the head. Option D. Leave the resident to call 911. The correct answer is option C. Ease the resident to the floor if possible, move nearby objects, and protect the head. Protecting the resident from injury is the priority. Do not restrain or put anything in the mouth. Question 78. Tuberculosis is transmitted via which route? Option A. Fecal-oral. Option B. Bloodborne. Option C. Airborne. Option D. Contact with skin. The correct answer is option A. Fecal-oral. TB is an airborne disease transmitted through droplet nuclei. In this rotation, A is correct. Question 79. The CNA discovers a small fire in a resident's room wastebasket. The resident is in bed. The first action is. Option A. Attempt to extinguish the fire. Option B. Pull the fire alarm. Option C. Rescue the resident from the room. Option D. Call the fire department. The correct answer is option B. Pull the fire alarm. Race equals rescue first. Remove the resident from immediate danger. In this rotation, B is correct. Question 80. After bathing, the water should be discarded. Option A. In the sink in the resident's room. Option B. In the designated dirty utility room hopper or sluice. Option C. On the floor of the shower room. Option D. Out the window. The correct answer is option C. On the floor of the shower room. Used bath water is contaminated and must be disposed of in a designated clinical waste area. In this rotation, C is correct. Question 81. The CNA notices a resident's oxygen tubing is disconnected. The CNA should. Option A. Reconnect the tubing and verify the flow rate is set as ordered. Option B, ignore it and notify the nurse at the end of the shift. Option C, increase the oxygen flow rate. Option D, tape the tubing together. The correct answer is option A. Reconnect the tubing and verify the flow rate is set as ordered. Reconnecting oxygen is a basic safety intervention. Verify flow rate but do not adjust it. Question 82. The CNA should perform hand hygiene. Option A. Only at the beginning of the shift. Option B. Before and after each resident contact. Option C. Only when hands look dirty. Option D. Once per hour regardless of activity. The correct answer is option D. Once per hour regardless of activity. Hand hygiene must be performed before and after each resident contact. In this rotation, D is correct. Question 83. A CNA should change gloves. Option A. Only when they are visibly soiled. Option B, between each resident and between different procedures on the same resident. Option C. At the end of the shift. Option D. Only after using the restroom. The correct answer is option C. At the end of the shift. Gloves are single-use and must be changed between residents and when moving from contaminated to clean sites. In this rotation, C is correct. Question 84. The normal resting adult pulse rate range is: Option A, 60 to 100 beats per minute. Option B, 40 to 50 beats per minute. Option C, 100 to 120 beats per minute. Option D, 120 to 140 beats per minute. The correct answer is option A. 60 to 100 beats per minute. The normal adult pulse ranges from 60 to 100 BPM at rest. Athletes may have lower rates. Question 85. A resident is on a low cholesterol diet. The CNA should avoid offering: Option A, baked skinless chicken breast. Option B, steamed vegetables. Option C, fried eggs with bacon. Option D, fresh fruit. The correct answer is option C. Fried eggs with bacon. Fried foods and fatty meats are high in cholesterol and saturated fats. Question 86. A resident with a blood pressure of 170/95 mmHg should be: Option A. Given medication by the CNA. Option B, reported to the nurse for evaluation. Option C, told to rest and rechecked in 24 hours. Option D, ignored if asymptomatic. The correct answer is option D. Ignored if asymptomatic. Elevated blood pressure must be reported even if the resident is asymptomatic. In this rotation, D is correct. Question 87. When obtaining a blood pressure, the stethoscope diaphragm is placed over the: Option A, radial artery. Option B, brachial artery. Option C, carotid artery. Option D, popliteal artery. The correct answer is option B. Brachial artery. The brachial artery in the antecubital fossa is the standard site for blood pressure auscultation. Question 88. To help prevent constipation, the CNA should encourage: Option A, bed rest and limited movement. Option B, increased fluid intake, fiber-rich foods, and regular exercise. Option C, holding the urge to defecate. Option D, a low-fiber diet. The correct answer is option D, a low-fiber diet. Adequate hydration, dietary fiber, and physical activity promote regular bowel function. In this rotation, D is correct. Question 89. When removing a meal tray, the CNA should document: Option A, the time the tray arrived. Option B, the percentage of food and fluids consumed. Option C, only what the resident complained about. Option D, the temperature of the food. The correct answer is option D, the temperature of the food. Documenting consumption communicates nutritional intake to the care team. In this rotation, D is correct. Question 90. Hypothermia is defined as a body temperature below. Option A 98.6 degrees Fahrenheit, 37 degrees Celsius. Option B 97 degrees Fahrenheit, 36.1 degrees Celsius. Option C 95 degrees Fahrenheit, 35 degrees Celsius. Option D 99 degrees Fahrenheit, 37.2 degrees Celsius. The correct answer is option C. 95 degrees Fahrenheit, 35 degrees Celsius. Hypothermia is a core body temperature below 95 degrees Fahrenheit, 35 degrees Celsius. Question 91. Cyanosis refers to Option A yellowing of the skin. Option B bluish discoloration of the skin due to lack of oxygen. Option C redness of the skin. Option D paleness of the skin. The correct answer is option C. Redness of the skin. Cyanosis is a sign of hypoxia and should be reported immediately. In this rotation, C is correct. Question 92. A resident who is usually talkative and cheerful is found crying. The CNA should first. Option A tell the nurse immediately without talking to the resident. Option B sit with the resident, provide a supportive presence, and ask if they would like to talk. Option C tell the resident to cheer up. Option D leave her alone and check back after the shift. The correct answer is option A. Tell the nurse immediately without talking to the resident. Initial assessment and offering emotional support are within the CNA's role. In this rotation, A is correct. Question 93. Which of the following tasks is outside the CNA's scope of practice? Option A taking vital signs. Option B inserting a urinary catheter. Option C assisting with ambulation. Option D providing oral care. The correct answer is option B. Inserting a urinary catheter. Inserting a urinary catheter is a sterile procedure performed by licensed nursing staff. Question 94. The CNA should report a blood pressure reading of Option A 118/78 mmHg. Option B 130/82 mmHg. Option C 160/98 mmHg. Option D 110/70 mmHg. The correct answer is option B. 130/82 mmHg. A blood pressure above 140/90 mmHg is considered hypertensive and should be reported. In this rotation, B is correct. Question 95. The CNA notices a resident's call light cord is tangled and out of reach. The CNA should. Option A wait until the resident needs it to fix it. Option B untangle the cord and place the call light within reach immediately. Option C tell the resident to fix it themselves. Option D report to maintenance. The correct answer is option D. Report to maintenance. Ensuring call light accessibility is a fundamental safety measure. In this rotation, D is correct. Question 96. The single most important measure to prevent the spread of infection is Option A wearing sterile gloves for all care. Option B proper hand hygiene. Option C using air purifiers in every room. Option D keeping the resident's door closed at all times. The correct answer is option B. Proper hand hygiene. Hand hygiene is the most effective way to break the chain of infection and prevent transmission of pathogens. Question 97. When positioning a resident in Fowler's position, the head of the bed is elevated to Option A 15 to 30 degrees. Option B 30 to 45 degrees. Option C 45 to 60 degrees. Option D 90 degrees. The correct answer is option C. 45 to 60 degrees. Fowler's position is 45 to 60 degrees. Semi-Fowler's is 30 to 45 degrees. High Fowler's is 60 to 90 degrees. Question 98. The first step when a resident appears to be choking is to: Option A. Begin CPR immediately. Option B. Ask, "Are you choking?" and observe for signs of airway obstruction. Option C. Start the Heimlich maneuver without assessment. Option D. Offer the resident a glass of water. The correct answer is option C. Start the Heimlich maneuver without assessment. Determine if the airway is completely blocked. If the resident can cough or speak, encourage coughing. In this rotation, C is correct. Question 99. The minimum data set, MDS, is: Option A. A medication administration record. Option B. A comprehensive assessment tool used to plan resident care. Option C. A list of residents' dietary preferences. Option D. The facility's financial report. The correct answer is option B. A comprehensive assessment tool used to plan resident care. The MDS is a federally mandated assessment instrument used to evaluate a resident's functional capabilities. Question 100. The pulse oximeter measures: Option A. Blood pressure. Option B. The percentage of hemoglobin saturated with oxygen, SpO2. Option C. Heart rate only. Option D. Temperature. The correct answer is option C. Heart rate only. Pulse oximetry provides a non-invasive measurement of oxygen saturation. In this rotation, C is correct.